from your perspective, can you give a like an overview of the PNG's health system that we inherited and the changes that you've seen happening over the years?
Okay. Maybe the best way I can make reference to is maybe what I try to do as Secretary for Health. Because I think we tried to do that, the plan 2011-2020 National Health Plan, in a way that captured international regulations and linked that with what we were experiencing in Papua New Guinea at that time. So what we tried to do there was we had basically two things done. The National Health Service standards and, completed, have that plan done in a way that made some sense to how we would move on as I took over the secretary's job. So the National Health Service standards in the National Health Plan were what I felt would be things. So how we did the plan also was very interesting, with full consultation with the provinces as far as we could go. Not haphazard, but just with consultation. We did the plan, and the plan had, I think one of the things was I think maybe I should focus on the National Health Service standards, because the standards, we had 7 levels of facilities. Now I get that's come down to 6, I think, 6 or 5. I'm not 100% sure, but the way the plan was done, we also had it really endorsed by World Health Organization. In fact, the regional director came to oversee the launching of the plan. So we tried to do it in such a way that we had links with the international community as well, and to set international standards or best practice. So the basic idea there was that we would have those 7 facilities at the time clearly defined, the different roles at each level of facility, which means that each level of facility would have staff that reflected the function of that facility. So you can imagine there would be, let's say, a community health post. That's one of my favorites. The community health post would have 3 basic functions: a public health function, maternal health function, and a child health function. So those three arms would basically be clearly defined what role each of those functions of that facility would be. And you might know now the community health post structure has got cross-shaped structures throughout the country. And the cross-shaped structures were 1 administration, 1 child health, 1 maternal health, and 1 public health general. And the administration block sort of thing. Those were the concepts at that time. But if that concept is translated into proper human resource for that particular facility, then you would have a functioning facility that would ensure that those functions were effective at that level. The same as an aid post right up to a super specialist hospital. Then you would expect the financing of it to be done according to the terms of reference and so on of that human being that's supposed to work there, plus the functional role of that particular facility. Then you'll find the costing would be done clearly. The political influences will not be there. So you place that facility at a location that is accessible to everyone.
Right.
But I'm telling you this because as I see it, all the standards are not being addressed as we should. If we did those, then you'll find that the costing would be done according to the function of that facility at that level.